Good day. I am Glendale A. Palacio, and together with my partner, Sharnila S. Susing, we're going to talk about conduction abnormalities.
Conduction abnormalities. The heart electrical signals are initiated in its natural pacemaker, the sinus atrial node or the SA node, then travel through the atrial ventricular node or the AV node. The AV node is the gateway through the ventricles. The AV node passes to the bundle of His, then the bundle is then divided into left and right bundle branches, which conduct the impulse towards the apex of the heart. The signals are then passed on to fascicular branches and spread through millions of Purkinje fibers over the ventricular myocardium. Heart block is a group of disease characterized by presence of an obstruction or a block in the heart electrical pathway. A block may slow down the conduction of the impulses or, in more severe cases, completely stop them. Heart blocks are classified by location where the block occurred. Accordingly, there are SA nodal block, AV nodal block, intrahischian block, bundle branch block, and fascicular block. Of these, AV nodal blocks or AV blocks are the most clinically significant. In fact, very commonly the heart block is not specified, otherwise is used to describe AV block. In AV block, the electrical signals are slow to reach the ventricles or completely interrupted before reaching the ventricles. There are 3 degrees of AV block. The first degree AV block is occur when all the atrial impulses are conducted through the AV node into the ventricles at a start lower than normal. The second degree atrioventricular block type 1, it occurs when there is a repeating pattern in which all but one of a series of atrial impulses are conducted through the AV node into the ventricles. The second degree atrioventricular block type 2 occurs when only some of the atrial impulses are conducted through the AV node into the ventricles. Lastly, the third degree atrioventricular block occurs when no atrial impulses is conducted through the AV node into the ventricles.
There are 3 degrees of AV block. The first degree AV block happens when the travel of the electrical signal are slowed as they pass from the SA node to the AV node. But all of them eventually reach the ventricles, resulting in ventricular depolarization. In ECG, it is characterized by a longer PR interval. First degree AV block rarely cause symptoms or problem and generally do not require treatment. On a second degree AV block, it is subdivided into type 1 and type 2. In type 1 second degree AV block, it is also referred to as Mobitz 1 or Winkelbach block. In this type, the AV node was not able to repolarize adequately by the time the next electrical impulse arrived, so the electrical conduction will be slower than the previous. In ECG, this is seen as a progressive prolongation of PR interval, followed by a P wave without a QRS complex. This is known as a block P wave or a drop QRS complex. As the AV node recovers, the cycle then restarts over as it usually repeats in a regular cycle. This is called the Winkelbach phenomenon. Second degree AV block type 1 are usually mild and no specific treatment is indicated. In type 2, second degree AV block, some of the electrical signal do not reach ventricles. In ECG, this is seen as an intermittent non-conductive P wave, and the PR interval, however, remains constant in conducted beats. In majority of cases, the successfully conducted QRS complex may appear broader than usual. Second degree type 1 AV block is less common than type 1. but is more dangerous as it frequently progresses to complete heart block or cardiac arrest. Implantation of pacemakers are recommended for this type of AV block. Lastly, the third-degree AV block, also referred to as complete heart block. In this condition, none of the electrical signals of the atria reach the ventricles. With no input coming from the atria, the ventricles try to generate some impulse on their own. This is known as an escape rhythm. In ECG, two independent rhythms can be seen. A regular P-wave pattern represents the atrial rhythm, and regular but unusual slow QRS pattern represents the escape rhythm. Having two impulses stimulate the heart results in condition referred to as AV dissociation. Clients with third-degree AV block are at risk of cardiac arrest. They require immediate treatment, cardiac monitoring, and pacemaker implantation. These are the clinical manifestations of each degree of AV block. The first-degree AV block often does not have any symptoms. It may be found when your healthcare provider is examining you for some other reasons. In more severe cases, people may have an uncomfortable awareness of the heartbeat. In the second-degree AV block, the clinical manifestations are chest pain, fainting or syncope, heart palpitations, breathing difficulties such as shortness of breath during exertion, rapid breathing, nausea, and excessive fatigue. And the third-degree AV block, the clinical manifestations are dizziness, angina, heart failure, chest pain, fainting or syncope, dizziness, excessive fatigue, shortness of breath, and lightheadedness.
Diagnostic and laboratory procedures of conduction abnormalities. Doctor may ask questions about your personal and family medical history. As part of your physical exam, your doctor may listen to your heart, record your heart rate, and measure your blood pressure. Then doctor may order an EKG, which records your heart's electrical activity. Then blood tests to look for potentially reversible causes, including high or low blood electrolyte levels, or endocrine disorders such as hypothyroidism, or to check medicine levels. Holter or event monitor to record your heart's electrical activity over a long period of time while you do your normal activities. Next is implantable roof recorder to look at the heart's electrical activity over a longer period of time or to find a diagnosis if earlier tests do not rule out a conduction disorder. Next one is stress test to look at changes in your heart's activity that occur with an increase in heart rate during recovery after exercise. Cardiac magnetic resonance imaging or other types of imaging to look at the heart structure. Echocardiography to look at the heart structure and how well it is working. Electrophysiology study to look at the electrical activity of the heart and to find the sources of an abnormal heartbeat. The study uses a wire to stimulate your heart electrically. Lastly, genetic testing. It is to confirm a genetic diagnosis, as in some ion channel disorders.
In treatment modalities, in the first-degree AV block, it doesn't need treatment. Your healthcare provider may ask you to have regular follow-up visits, but you may also be asked to take your own pulse and be alert on changes in your heart. On a second-degree AV block type 1, patients are asymptomatic, do not require treatment, and can be monitored on an outpatient basis, while symptomatic patients typically respond to atropine and rarely require permanent cardiac pacing. On a second-degree AV block type 2, patients require transvenous pacing until a permanent pacemaker is placed. And lastly, on a third-degree AV block, patients require urgent admission of cardiac monitoring, backup temporary cardiac pacing, and insertion of a permanent pacemaker.
Medical management. Atropine is prescribed to increase heart rate in severe types of AV block. Beta blockers are prescribed to decrease the activity of the stress hormones and make your heart beat more slowly. Examples of beta blockers include nadolol, propranolol, and metoprolol. Lastly, other medicines such as antiarrhythmetics may be used to treat certain types of arrhythmias. Surgical management. Pacemakers to help your heartbeat at a normal rate. Several conduction disorders including SS and more several types of AV blocks are treated with a pacemaker. Pacemaker may prevent fainting and improve survival. With research, new, more effective pacemaker technologies are emerging. Complications from pacemaker may include infections, bleeding, and damage to the hearts or heart valves. Next one is the radiofrequency catheter ablation. This is to help prevent abnormal electrical activity. This type of catheter ablation uses radiofrequency energy to destroy a small section of heart tissue that is causing the abnormal electrical activity or arrhythmia. Other procedures such as placing an ICD, a type of defibrillator, or wearing away or removing nerve that are overstimulating the heart, called left cardiac sympathetic denervation. It may be used to treat arrhythmias.
The nursing diagnosis. Risk for decreased cardiac output related to alteration in heart rate, rhythm, and conduction as evident by incident and death. The nursing interventions are palpate pulses, noting rate, regularity, amplitude, and symmetry. Document presence of pulsus alternans, bigeminal pulse, or pulse diffusive. The rationale for this is the difference in equality rate and regularity of pulses are indicative of the effect of alternative cardiac output on systemic or peripheral circulation. Second nursing intervention, auscultate heart sounds, noting rate, rhythm, presence of extra heartbeats, and drop beats. The rationale for this is hearing extra heartbeats or drop beats helps identify unusualities in the unmonitored patient. And the third nursing intervention, provide quiet and calm environment. Review reasons for limitation of activities during acute phase. Rationale for this is reduces stimulation and release of stress-related catecholamines which can cause or aggravate dysarrhythmias and vasoconstriction, increasing myocardial workload.
The second nursing diagnosis for conduction abnormalities is knowledge deficit related to lack of information of medical condition and therapy needs as evidenced by statement of misconception. The nursing intervention for this diagnosis are, first, assess patients and SO level of knowledge and ability and desire to learn. It is necessary for creation of individual instruction plan. Next one is reinforce explanation of risk factors, dietary and activity restrictions, medications, and symptoms requiring immediate medical attention. This is to provide opportunity for patients to retain information and to assume control and participate in rehabilitation program. Then, review safety precautions, techniques to evaluate and maintain pacemaker and symptoms requiring medical intervention. This is to promote self-care, provides for timely interventions, and to prevent serious complications.
Third nursing diagnosis, activity intolerance related to imbalance between oxygen supply or demand. Nursing interventions are assess patient's general condition. Is to note for any abnormalities and deformities present within the body. The second nursing intervention is to encourage patient to have adequate bed rest and sleep. This to relax the body and promotes comfort to the client. And the third, nursing intervention to give client information that provides evidence of daily or weekly progress. This is to sustain motivation for the client.
Now, we were going to discuss the prognosis. For first-degree AV block, the prognosis is very good. Progression from isolated first-degree heart block to high-degree block is very uncommon. Patients with first-degree AV block and infranodal blocks, however, are at increased risk for progressions to complete AV block. For second-degree AV block type 1, the prognosis is excellent. This is usually asymptomatic and requires no interventions in asymptomatic patients.
On the second-degree AV block type 2, the prognosis varies based on the cause of the rhythm. Patients require placement of implanted pacemaker device to avoid complications of Mobitz type 2 AV block, such as decreased cardiac output, symptomatic bradycardia, and sudden cardiac arrest. Lastly, the third-degree AV block, the prognosis likely is dependent on the patient's underlying disease burden and severity of the clinical presentation on arrival. Complete heart block is sometimes reversible in settings such as acute myocardial infarction by restoring coronary perfusion and in conditions such as Lyme disease by treatment with antibiotics. I hope you learned something. Thank you and God bless.